Let's revise one of the most important physiology topics, that is cardiac cycle. In the next few minutes, we will revise its definition, phases, pressure volume changes, origin and significance of first and second heart sound, and the physiological basis of murmurs. So let's revise. Cardiac cycle definition: the sequence of events occurring in the heart beginning from one heartbeat to the beginning of the next heartbeat is known as cardiac cycle. The duration of each cardiac cycle is 0.8 seconds. Now, what are the phases of cardiac cycle? There are 4 phases, that is atrial systole, atrial diastole, ventricular systole, and ventricular diastole. In ventricular systole, we have 2 phases: isovolumetric contraction and ventricular ejection. In ventricular ejection, we have another 2 phases, that is rapid ejection, second slow ejection. Now, ventricular diastole also has 2 phases, that is isovolumetric relaxation and ventricular filling. The ventricular filling phase has another 2 phases, that is rapid filling, second is slow filling. Atrial systole, the duration is 0.1 second. In atrial systole, the atria contract and force the remaining blood into the ventricles. Here, the atrioventricular valves are open, the semilunar valves are closed. It contributes to 20 to 30% of ventricular filling. Now, the second phase is atrial diastole. Here, the atrial filling occurs. It follows just after the atrial systole. Ventricular systole, the duration is 0.3 second. It has 2 phases, that is isovolumetric contraction and ventricular ejection. Isovolumetric contraction. Here, the ventricles begin to contract. The atrioventricular valves close, due to which the first heart sound is heart, that is love. The semilunar valve remains closed here. Now, ventricular ejection. In ventricular ejection, when the ventricular pressure exceeds the aortic or pulmonary pressure, the semilunar valves open. The semilunar valves open and the blood is ejected into aorta and pulmonary trunk. The ventricular ejection are 2 types: rapid ejection and reduced ejection. In rapid ejection, about 70% of the blood is expelled, but in reduced ejection, the remaining blood is expelled. Ventricular diastole, duration 0.5 second. It has 2 phases, that is isovolumetric relaxation and ventricular filling. In isovolumetric relaxation, the semilunar valves are closed, due to which the second heart sound is heart, that is dub. All valves are closed during this stage. Now, ventricular filling. It has 2 phases, either rapid filling, then reduced filling. In rapid filling, the atrioventricular valves are open. Here, the rapid filling of ventricles occur. In reduced filling, slow ventricular filling occurs. Pressure volume changes in cardiac cycle. First, during atrial systole, there is slight increase in atrial and ventricular pressure. The ventricular volume reaches maximum, that is the end diastolic volume. Second, during isovolumetric contraction, the pressure of ventricles rapidly rises. The volume remains unchanged. Third, during ventricular ejection, the pressure of ventricles are at the peak position. The volume of ventricles decreases from end diastolic volume to end systolic volume. Now, fourth, during the isovolumetric relaxation, the pressure rapidly falls. The volume remains unchanged. Fifth, during ventricular filling, the pressure remains low. The volume starts increasing. Origin and significance of first and second heart sound. First heart sound. Origin. It is due to the closure of atrioventricular valves. Characteristics. It is low pitched but prolonged. It is the love sound. Now, what is the significance of first heart sound? S1. It indicates the beginning of ventricular systole. Loud S1 occurs in exercise and hypertension. Diminished S1 occurs in short and acute myocardial infarction valves. Characteristics. It is high pitched but short. It is the dove sound. What is the significance of the second heart sound? It indicates the end of systole and the beginning of diastole. Loud A2, that is aortic component, occurs in aortic hypertension and aortic dilatation. Loud pulmonary or P2 component occurs in pulmonary hypertension and pulmonary dilatation. Diminished aortic, that is A2 component, occurs in aortic stenosis. Diminished P2, that is pulmonary component, occurs in pulmonary stenosis. Now, murmur. What is a murmur? A heart murmur is an abnormal sound produced due to turbulent blood flow into the heart or the great vessels. Now, what are the causes of murmur? First cause, valve stenosis. Stenosis means narrowing. Second, valve regurgitation. Third, congenital heart diseases like ASD, VSD, ASD pulmonary atrial septal defect, VSD ventricular septal defect. Now, what is the physiological basis of murmurs? Normally, the blood flow is laminar and silent, but when the blood flow becomes turbulent due to narrowing or leakage of valves, there is abnormal sound produced called murmurs.